Joining us right now is Dr. Angela Fitch, president of the Obesity Medicine Association. It's remarkable news. I know a lot of folks are trying to just make sense of the news unto itself and how the mechanics of it even work. Do you understand it?
Well, yes, we do. And again, it is a very exciting and pivotal time in obesity treatment because there's so much bias and stigma on the disease of obesity, which is that, the disease isn't something that needs to be treated. And now that we have data to show a decrease in mortality and an increase, in the ability to tolerate this medication, there was a lot of safety data that came out of this trial too for 5 years. So it's the longest trial we've had with this drug up to date.
But do we understand the mechanism insofar as it appears that risk, that cardiovascular risk, is reduced before the weight loss takes place, which is such a unique sort of way to think about it, because I think the conventional wisdom was you needed to reduce your weight first.
Well, that was the conventional wisdom, again, because of this bias and stigma around the disease of obesity. And we know now that there's more to it than just the weight loss itself. We're really about helping patients optimize their metabolic health. At Knownwell, which is where I work now, and the clinic we created our clinic to look at the metabolic health of individuals and help them optimize that across their entire lifetime in a longitudinal fashion. And this is something that, everyone should be thinking about. It's the same thing with statin drugs as well. We know that while statin drugs lower LDL, they do more than just lower LDL. They prevent the risk of heart attack and stroke. And so again, these medications, work in a similar way by decreasing inflammation. They decrease the hypercoagulation that goes along with having obesity, so you're not as likely to have blood clots. And so again, these drugs have very significant effects that we have known for a long time. We just haven't been able to prove it until now.
Okay. Yeah, that's what I'm seeing now in the literature, doctor, is that some of the diabetes, I'm not familiar with what a semaglutide is, but for more than a decade, there's been some evidence that there's cardioprotection from diabetes drugs. So this is just putting it in actual numbers and statistical terms. Is that the difference now? So we kind of knew this, I guess.
We did, but we didn't know it in people with obesity without diabetes. So the critical feature here is this is patients without diabetes that are taking the drug for obesity. Again, these are not weight loss drugs. These are drugs for obesity. And that is what we're talking about treating here, is this disease state that is affecting, more than 40% of the United States. And so again, it's very important for us to recognize that obesity is treatable. And now we have a treatment that can prevent heart attack and stroke at the same time.
Would someone not obese and not diabetic, but take one of these drugs for their heart health?
Well, we don't have that data today, right? And I think, that's going to take, this trial took a long time. It was during the COVID pandemic. So we'd like to thank all of the 17,000 patients that participated and all of the clinicians that helped to lead this trial, because it's a very pivotal trial of our time. And again, it took an army to do it because it was during COVID, which is a challenging time to complete clinical trials.
So the question that I have is, do you now that we know this, how widespread do you think people are going to be taking this? I mean, it used to be that we were dealing with obesity in the classic sense. Do you think that people of all stripes and sizes are going to be taking this medicine?
Well, I think if you have obesity and you have a known history of cardiovascular disease, so these patients had not only just obesity, but they had a history of cardiovascular disease, those patients should definitely have coverage for this medication. That's one of our other issues today, is that for the disease of obesity, it is not a standard benefit on insurance policies. And so employers have to choose to add obesity treatment to their package, and they have to pay more in premiums. And this is a big deal because we don't have access to these effective treatments for patients like we have for cancer or diabetes or other types of treatment in the United States. And so it's hopeful that this type of data will show insurance companies that it's worth it to treat obesity.
Medicare has to decide too. This
Medicare has to decide, and then
going to blow the budget out on money.
And then you're going to have to do a real mathematical model, though, about how much this drug should cost, how much it's really saving, how much it's,
how much it saves versus all the issues that come with
exactly
obesity, right?
Well, and the good news was with this trial going for 5 years, there was a lot of good safety data that came out of this data. So again, we know now that these drugs are safe and effective, and we do need coverage for this type of treatment for the many Americans that need it.